Good afternoon, everyone, and thank you all for joining us for our Restart Kentucky webinar. This is actually our second of the day, so it's been a great day for webinars. We had one earlier this morning with the Governor's Deputy Chief of Staff, Jonathan Smith, as well as the Deputy Secretary of Education and Workforce, Josh Benton, talking about the reopening requirements as well as unemployment insurance. Just a reminder that we do put all of these webinars on our website, kychamber.com, after they are done, so we encourage you guys to check those out. We also want to always thank our sponsor in this endeavor with our webinars, our Community and Technical College System, KCTCS, who's been a great partner to us the last couple of months as we have all worked to restart Kentucky. So this is a great webinar today, very special guests included, as you can see on your screen. We do have Governor Andy Beshear, and we're going to talk today about contact tracing. So we have some friends of ours, Mark Carter, who's now special advisor on this project. Mark is no stranger to the Chamber. In his previous role at Passport as CEO, he was on the Kentucky Chamber Board. So he is a good friend of the Chamber, as well as we have many people from Deloitte who is working on this project as well. Also good members of the Chamber, so thank you all for your participation in this. And before I kick it off to the Governor, we just want to say from the Kentucky Chamber and the businesses across Kentucky, thank you to you and your office for working so closely with us these last couple of months in a pandemic that none of us could have seen, but we really appreciate you working so closely with the business community, whether it's trying to get much needed PPE to our small businesses or working with us on requirements to make sure that our businesses are opening in the safest way possible to protect all employees and all patrons. We really do appreciate your communication and your work with us as we move forward, and we're excited. I was just saying before we hopped on, the last couple of weeks, I think we've seen a lot of optimism within our membership and the business community. Now that we have dates on the horizon and businesses start reopen. Retail opened yesterday, restaurants are open tomorrow. I actually have a dinner reservation tomorrow night, and so I am really excited. I've been at home with 2 children, homeschooling and working for 2 months, so I feel very optimistic. But
haircuts on Monday.
Exactly. So thank you, Governor, for joining us, and with that, we'll be respectful of your time and go ahead and turn it over to you, and then we'll hear the presentation from Mark.
Well, let me start this the way I always do. Reminding everybody that we're going to get through this and we're going to get through it together. And that means something special on this call because the Chamber has been a great partner in addressing this pandemic. Ashley and the Chamber reached out very early, asked how they could help and being willing to help in any way. And it was everything from being one of the major collectors of PPE to get to our hospital systems when they were out. It's not where we sit today. We sit in a much better place, but a month and a half ago, things were really dire at different times, and the Chamber was there helping us out, making calls just like we were here in the Governor's office, and I know many of you were as well. The Chamber has continued to be a great partner in creating PPE supply chains, and we've connected with testing resources. And so during the course of this has been not only a meaningful partnership, but the Chamber, in my humble opinion, has been responsible, has wanted to do the right thing, and has really stepped up. So I greatly appreciate that. So where we are today is in such a different place than where we were on March the 6th when we had our first case. That's the day, at least I remember, that we had our first case. Starting on March 6th, we saw a significant escalation, the type you see in these 1 every 100-year pandemics. It did threaten to overwhelm our healthcare system and threaten the lives of, in my initial model, 80,000 Kentuckians. That's originally what even some conservative models had suggested. But thanks to your sacrifice, mainly thanks to the people across Kentucky and us taking quick, decisive action, what happened in so many places, or is happening now in many places, did not happen in Kentucky. We didn't see what New Orleans or multiple parts of New York or different parts of New Jersey or now parts in Massachusetts and some in Minneapolis have seen. What we were able to do is to flatten our curve in a way that no one in human history has ever been able to do. And I hope you're proud of your part in that because you were a real part in that. And I believe that we, are all going to be able to look back on history, or our kids and grandkids are going to read about history. And they are going to see that the way that we have acted during this period of time is the most successful response to a pandemic that we've ever seen. Now, what we did came at a cost, and we all know what that cost is, and I believe it's a temporary cost, but it's about the economic hardship that it's created. And I'm going to be clear, there has been significant economic hardship, but I believe it's short term, it's a pause. And our goal now is to restart, but to do it sustainably, to do it in a way where we've all seen the chart, I hope now, of Philadelphia versus St. Louis, that we do not have that second bump. I'm convinced that our economy will be one of the strongest state economies if we do not have to pause again, if we have the type of practices where we don't have to shut down or pause a single business even. And we may see outbreaks here and there. But if we can do that, if we can be healthy at work, we're not just in a better place in the coming months. We truly don't know when a vaccine will be ready, though I seriously hope it will be the end of the year or early next year, but we'll be in a position where we can continue and continue better than other states based on the way that we're going about this. But to go about it takes a couple of tools. Number one, it was flattening the curve and continuing social distancing in our workplace. So now we are at work, but we are taking the precautions of masking in common areas and when we're close, but also separately social distancing, separate offices, those types of practices. That is still the number one way to reduce the spread of this virus. But knowing that now we're going to have more contacts, because we're going to talk about childcare later today at 5, knowing that more people are going to be around each other, groups of 10 starting tomorrow, restaurants, and hopefully moving in a month or so to groups of 50 or under, there's going to be more contacts. And so the virus is going to spread more. We know that, but we believe that since we flatten that curve and have the healthcare capacity, now we can get to a stage where we can contain it very locally or micro-locally. But to do that takes testing and tracing. And first, let me start that these aren't, we know, political terms or tools. They are public health tools that have been used for a long time. Tracing has been used with a number of different types of outbreaks. It was actually developed to deal with syphilis. And then testing we do for all different types of communicable diseases that are out there. And think of the flu vaccine. And this is all a part of public health. And the importance, and one of the reasons I wanted to talk today about how we're doing it, is we need to make sure that none of this is politicized moving forward and that we have everybody's buy-in from the business community. Because if people don't answer the call on tracing, if people aren't willing to go out and get tested to the degree we need to, then we can't identify where there is an outbreak and contain it. And that threatens everybody's business. Now, what we need to be able to do is if somebody is coming in, they get that temperature check, they have a fever, we send them immediately to get tested. If they're positive, we do the tracing. We put a big bubble around it to keep it from spreading any further. That's the best thing for the health of our people and also the health of our economy, that we can contain the virus before it takes out potentially an entire shift, before it requires other major steps, before it disrupts business or endangers the health of our community. So what I really need for folks on the call is to be leaders in encouragement of the best practices, dispelling fear, asking people to answer the call. And that's a big part of what we need. When that phone rings and it says Department of Public Health, people need to answer the call, even knowing that it might mean they're spending 10 days without coming to work. I mean, that's important in protecting work, but it's really important in protecting each other. And so while it's an act of citizenship, I hope you encourage it as an act of being a team member in your areas of employment. And then I'm going to need your help if there is an attempt to politicize any of this, to push that aside, because these are the public health steps pushed by the White House, by the documents that have been pushed down to us and are supported by public health officials and business leaders at every stage. I had a call with the National Governors Association the other day with one of the major CEO roundtables. They were all talking about this and the importance of it and needing to make it work and what they're doing help make it work. Kroger was on there. We love that because, obviously a lot of stores around Kentucky and one of our major testing partners. So let me briefly tell you where we are on testing, and then Mark Carter is going to run through tracing. And I'm very excited to have Mark's experience and expertise in this. On the testing side, we are at a place that we always dreamed we would. I had to stand up at that podium for so many weeks and tell a scared public that we didn't have enough tests for everybody. And that was hard. We had people worried about their kids and grandkids, worried that they might be taking it home or taking it to the grocery store, and they couldn't find out. And that was really, really hard. Now, because of the work of Kentucky businesses, 3 labs that are now booming, and I think will be major businesses moving forward in Kentucky. This is Kentucky and Solving Kentucky Challenges. We have enough capacity to do 2.5 times the recommended amount of testing that the White House suggests every month. Our challenge is now getting people to go to the testing, and we're going to need your help in that too. Remember, your workforces are safest if people are tested, even once a month. But if you could encourage everybody to be tested once a month, that helps us know the asymptomatic people out there, the overall rate to develop those policies, and it would allow at potentially later dates other reopenings if we know the asymptomatic rate is going down too. But now we have over 50 locations all over the Commonwealth. Should be very easy, and we want to encourage that. But the second piece is the tracing part. And that's what Mark has come in to help the administration on. Let me first say that this is not what some out there are suggesting, where people are tracking your movement with apps. We don't do that at all. This is a system where somebody who tests positive has a conversation with a trained professional that goes through the contacts they've had since they've been symptomatic. And that doesn't mean that everybody that's been in contact with that person is going to be quarantined. It depends on a number of different factors, but it's really important that people buy in. They know this is a part of living with this virus, and it's meeting our calling that we've done thus far. It's protecting other people and making sure that this virus doesn't get into any other long-term care facilities or anywhere else. And I think, as Mark will show you, it's an easy system, but it's one we're going to need you to work with. Your HR departments are going to be invaluable for knowing any potential exposure, how your business is set up, what type of natural barriers that there are. And so I believe that this will be a process that our tracers will work directly with you in a very positive way, where the end that we all want is to make sure your people are healthy, that you don't have the virus spreading further in any of your facilities. So I think this could be a really good partnership. I think it could be really helpful to your businesses. And I also think that you as business leaders will be absolutely critical to providing the credibility for this program that will ensure that people buy in and we continue this historic response we've had to COVID-19. So thank you, all of you. Thank you. Regardless of where you are or how you feel about things at this moment, you've saved lives. You've absolutely saved lives. And there aren't a lot of generations that can say that. There aren't, unless you're in healthcare, a lot of business leaders that necessarily can say that on a daily basis. All of you can. I'm very grateful. Let me turn it over to Mark Carter.
Thank you, Governor. And thank everyone for sharing a little bit of your afternoon with me. I'd like to start out just a brief comment around why I got involved in this. I was talking with Ashley before we got started, and I asked about Dave Adkison, and she said that he was enjoying his time on Lake Cumberland. Lake Cumberland is a place that I've spent a lot of time as well, and I self-isolated there for much of the time period we're talking about. So, you know, I had a nice retirement, but I did get a call from the governor. He is a persuasive fellow, and you know, this is just a critical component of our plan to keep the reopening going at the appropriate pace and getting our society reopened and our economy back on track. From my personal perspective on contact tracing, The way I'd like to think about it is that if I received a diagnosis of COVID and I became sick with it, I know my first emotion would probably be fearful, and not necessarily fearful for my own well-being, because I would probably have the attitude, well, I'm just going to beat this bug. But I'd be fearful that I had infected somebody I loved, my wife, my kids. I have 6 grandkids. I have an 87-year-old father. I think I would be probably more worried about that than anything else. And I think that's probably true of everyone on this call. And so the way I like to think about contact tracing is really, it's a tool that the Department of Public Health and the local health departments are giving people like me that might get infected to keep their loved ones safe and well. And so that's how I'm approaching the interaction and the leadership I'm trying to provide to this particular aspect of our plan. And I think that's a good way to explain it to folks as to why it's important. What I'd like to do is I've got about a short 3-minute video that I'd like to show you. And Mike, if you'll tee that up, we'll play that first. And I have about 4 slides I'll go through, and then we'll open it up for questions and answers. Mike, will you play the video?
To minimize the spread of COVID-19, public health workers need to know about exposures to make sure that all Kentuckians are safe and supported. We are using Kentucky's contact tracing and tracking system to help our disease investigators and contact tracers to gather the necessary information. Let us take the example of Sarah Smith, who is a disease investigator who starts her day by looking at a list of cases to act on. These cases are individuals who have tested positive for COVID-19. She picks up the case of Bobby Rim. Sarah reviews details about Bobby. She calls Bobby and begins the initial investigation. The system provides call scripts so disease investigators can be consistent with their messaging and make sure they do not miss any important information. Sarah confirms Bobby's symptoms, understands his needs around food, housing, and childcare, and finally, Sarah helps Bobby retrace his steps to document who he may have come in close contact with and which public settings he may have gone to while he was infectious. Among those people is Jan Johnson, who is Bobby's coworker. Once the call is complete, Bobby is directed to isolate since he is positive for COVID-19. To assist Bobby in recovery, the system automatically sends an email with helpful information. Sarah follows up with Bobby daily to make sure Bobby is okay and address his needs if they have changed. Once Bobby recovers or is no longer infectious, the case for Bobby Rim is closed. Once investigation is complete, the information is handed off to a contact tracer. Contact tracers are public health workers. Contact tracers such as Fred notify individuals who may have come in contact with Bobby, such as Jan Johnson, who works with Bobby. Fred calls Jan and notifies her of potential exposure to a COVID-19 patient. Fred is provided a call script to assist in gathering information he needs from Jan. Fred confirms demographic information, asks Jan if she has been having any symptoms, and gathers basic medical history. Based on Jan's responses, the system sends a tailored email to Jan with helpful information. Fred follows up with Jan daily to check on her symptoms and understand her evolving needs for support should she start noticing symptoms. After Jan's exposure timeline has expired and she hasn't encountered any symptoms, she gets an automated return to work email. To protect patients' confidentiality, case contacts will not be told the identity of the person who may have reported them. They will be told what they need to do to care for themselves, reduce the risk to others, and protect their communities from any further exposure. Contact tracing and tracking combines public participation and the power of technology to help public health officials and private healthcare providers contain the spread of COVID-19.
Mark, I think you need to unmute.
There we go.
There you go.
Okay, I think that video does a nice job of showing you just how the process will work. Obviously, it's at a high level. It's 3 minutes. The actual disease investigation and the tracing process, depending upon the type of exposure, could be quite extensive. But let me walk you through a few slides here. If we could go to the first one. This just shows three of the components or an overview of the COVID-19 contact tracing. The first there on the left is just the objective is to contain the spread, and that I think the governor did a fine job of giving an overview of why that's important to everybody on this call. At the core of this is an online tracking system, and I have to say I've been very impressed with this. The Department of Public Health here in Frankfurt, along with our partners with Deloitte, have essentially built a system that we just had a soft launch of today in a little over 3 weeks, less than 4. It's not ready for a full go live yet, but we're very close with the system. It's built on a Salesforce platform, which many of you are going to be familiar with. And while the rollout will probably need some additional enhancements, it's in a very good place to get started. And then finally, the focus here is just on keeping folks well. And if we do have an outbreak in a particular area, containing that as best we can, so that it has minimal disruption on our society and our economy. Next slide, please. This just a couple of comments on the roles. We've actually have 3 roles here: one of disease investigator, contact tracer, and then there's a third set of positions or competencies that we're hiring for, which is something called a social support coordinator. But essentially the division of the roles is the disease investigator, if you could think about it this way, is probably more of a clinician that's really trying to understand the severity of the illness with the patient, and those kinds of things. They will be asking about potential contacts, but once that disease investigation is concluded and the contacts are known, there's an assessment of the patient to see if they're, to see just where they are clinically. And then it's handed off to a contact tracer. And the contact tracer's job is to talk to the patient about who they may have come in contact with over a certain period of time leading up to their diagnosis, and essentially trying to identify each of those contacts and then assess each one of them in terms of risk along a low, medium, high type algorithm. The social support coordinator, which isn't depicted here, but essentially what that person does is for either the patient or the contact that might have to either quarantine or self-isolate, they may have needs in terms of they may not have access to food. They're and basically just daily living type things that they need assistance with. Contacting their employer could be one of those. That's what the social support coordinator would do. We have already onboarded a number of these positions, but over the next several weeks, we'll add up to 700 people in these positions distributed across the state. Next slide, please. In any kind of crisis, communication is critical. And I had some experience with this when I first came to Passport. And so we focused a lot of our attention on communications. These are just some examples of the collateral that are being distributed. They'll be on the KY COVID-19 ky.gov website, but will be distributed across the state and health departments, healthcare providers, and various points throughout the Commonwealth. Next slide, please. So what can you do to help in your businesses and in your local communities? These are the activities. First of all, help people that be aware that they could be contacted by a local public health department around the potential exposure of COVID-19. and help them understand the importance of the process and the importance of answering that call and participating in it. And I tell you that I think the best way to relate that to folks is to make it personal, because as I said, it's that the way I think about it is I sure don't want to infect somebody I love. And I think that's the key here. Spread the word in your local communities and keep an eye on the website and the governor's social media accounts for additional information and updates as we work together. I'm a longtime business person, and you know, we can have it both ways. We can have public protection and safety and wellness, and we can have a robust economy. But this particular disease, we've got to really manage it carefully. And I think the testing and tracing is the key to that. If we can do that together well, I think that we can get back to the place where our economy is booming again. So with that, I will conclude with just a couple of comments as we move to the question slide. I mentioned that on the contact tracing platform that we're using the technology to enable an effective process, that we did have the soft launch today. I think we'll be by the end of next week, certainly, and hopefully sooner, that we'll have most of the bugs worked out and we'll be able to move forward with that technology. Last week, we awarded an RFP to a number of agencies that are helping to identify disease investigators and contact tracers, and we basically have developed training curriculum for them that will go live on the website probably sometime tomorrow in terms of the links to how you seek those positions and get engaged, and they will be distributed across the state. So we're in a good spot there. And then obviously the communication is an ongoing thing that we'll continue to focus on to make sure the information is out to all of you and a number of other constituencies across the state. So Ashley, with that, I'll stop, and I don't know if we have anybody else that's going to comment on the government side, but I'll stop and we'll take some questions.
Thanks, Mark, and that was a great presentation. I do want to welcome Lieutenant Governor Jacqueline Coleman, who popped up. So she is now on the screen. Lieutenant Governor, I said, Jacqueline and I went to grad school together many years ago. So she and I have been friends for many years, but I'm still calling her Lieutenant Governor. So Lieutenant, do you have anything you want to add before we do move into questions and answers? We do have a lot of questions people submitted that I think will be some pretty good discussion as we move forward.
Right. Well, thanks, Ashley. And she's right. We won't say how long ago we were in grad school together, but it's been an interesting journey since then, for sure. So I know I've seen some questions about schools and the contact tracing that will happen as schools go back. I just want to let you know that we have asked our local school districts to come up with plans for their schools in several different scenarios that they can anticipate. And actually, Mark met with the superintendents and myself and the governor right before this call. And so he's been talking to them about ways to implement this type of thing in their own communities, especially when students are involved and we don't know what school's going to look like in the fall. And we won't know until it gets closer. So that's something that I know in terms of if we're talking about childcare and school systems, that a lot of folks who are going back to work are going to be concerned about. And so Mark's working on that, working very closely with our local school districts, and we're hopeful to give them as much flexibility as we can to meet the needs of their kids and their communities. So I'll leave it there because I know you're going to have a lot of questions. So it's good to see you, Ashley.
Yes, good to see you, and congrats. I was hoping the baby was maybe in the office and she could make an appearance. So we do have a lot of questions coming in, but I'm trying to kind of go through them. We had a lot submitted beforehand, but a couple things that I do want to answer because I want to be respectful of your all's time, and I think we have about 15 minutes. Is we've gotten a lot of questions about businesses that have been open, that have been deemed essential, and they are kind of already doing the contact tracing. And we've been talking to employers since the very beginning about making sure when an employee, while they're doing their daily health screening or they have a symptom, to get tested right away and to go ahead and contact the people they have been around. What is their obligation now that the Department of Public Health really is kind of taking over this endeavor? Do they need to still continue what they've been doing, or do they just need to let you all know what has happened and then you kind of take over the rest of it?
Well, I would start out by saying, Ashley, I think we all have a responsibility when it comes to managing this, that all the success boils down to how individuals behave. And, so if you believe you've come into contact with COVID or someone that's been infected by it, I think you take the precautions that you feel like you need to take to avoid infecting a loved one. Now, that being said, the way the process will work is essentially the local health department or the Department of Public Health will get a notification that someone has been diagnosed with COVID-19. And that's what starts this process. Now, it could come in a number of ways, but typically in things like this, the healthcare provider they basically are required to report these kinds of things to the local health department. And so that's what starts the process. Once that gets into the queue, then that patient is worked by the disease investigator and, follows the process that was outlined in the video. So, as far as contacts of that person, there is a privacy aspect. So the person who was infected, their identity is not disclosed to the contacts. They're just told that they have been in contact with somebody on X date or thereabouts that has been diagnosed with COVID. The contact essentially gets assessed as to whether or not it's a low, medium, or high risk. And that basically just has to do with the nature of the contact. If you just walked by the person and said hello in Kroger and you're both wearing masks, it's pretty low risk. And that person is given advice to simply monitor their health, and if they start to feel sick, to go see their provider. If you rode in a car from Frankfurt to Paducah for a meeting with someone who was then diagnosed, that's a different matter. That's prolonged exposure in an enclosed place, and you're probably going to be assessed as a high risk. So that's generally how it works.
Great. And we've talked a lot about if you're an employee. And so there's been some questions of how do employees keep track of people that have been in the building? I know here at the chamber, we only have a couple people coming into the office really kind of shipping out masks right now. But we do have a very simple app on our phone that we do our health screening every day. So it's been very easy before we come in. If you are in the building, you do your health screening. So I think for the people who have asked, what employees are coming in the building, if they're doing their health screening every day, you should know. But one question we got a lot from banks and restaurants, retail is, it's one thing to keep track of your employees. It's another thing to keep track of your patrons. And so talk a little bit about, now that retail is opened, restaurants tomorrow, how logistically will the tracers be able to figure out, if you ate at a restaurant, are other people infected? Talk a little bit about the consumer part of it rather than the employee part.
Yeah, that's the much harder part, as you outlined, is just how do you handle things like that. There will be a notification. If something like that happens and a person identifies that they went to a restaurant in Lexington, let's say, and there will be notification of the restaurant that occurred. Now, if the restaurant is following the guidelines and in terms of staying at a third capacity and keeping the appropriate spacing, maybe the person was outdoors in an outdoor dining area where the risk is far lower. All of that will be communicated to the employer. There's not a real good way, frankly, to go beyond that. I think, it gets tough as you get further and further from the contact and you get more distributed in who the contact might be. So, we'll try to get more guidance out on that, Ashley. I know I'm not doing a great job of answering that right now, but, if for some of these things, there just aren't good answers just yet. But
Well,
let me
learn
take
as
that
we
one
go.
and follow up.
Yeah, we learn as we go, and I think this is an important conversation to have, because as businesses reopened, we know a lot more than we did 2 months ago on how to reopen and how to social distance. I said, 2 months ago, none of us knew what social distancing or PPE meant, and now it's common lingo. It would have been rude 2 months ago not to shake someone's hand, and now we just don't do it. So we know more, and we're taking those into our practices as we reopen our businesses. And I think it's an important conversation to have, because there is concern that if there is a spike in the fall or whenever it comes, how can we still maintain public health and protect everyone's health, but maybe not shut down the whole economy? And so I do think it's important that we talk about these ways to make sure that we're doing this. One question that we're getting a little bit of is, we talked about privacy. Who has this? Obviously, the Department of Public Health would have all of this kind of data. What happens to it after a certain period of time? Who has access to it? I think that's kind of an important question people are asking, is just the privacy aspect of it, because it's a new program. We just want to kind of get comfortable with that.
Right. Well, as far as the privacy goes, this question came up with the superintendents, and the question ran to HIPAA. The governor answered the question, and that, that there had been some relaxing of some of the HIPAA requirements at the moment. The public health infrastructure in the state has, they've dealt with privacy issues for years. Contact tracing isn't new. It's used in TB and some sexually transmitted diseases, HIV. So protecting the privacy of the individual is sort of part of the culture in public health. And that's sort of underlies the reason that we, are not disclosing the name of the person that's infected to the contacts. To the best of my knowledge, most of this information is going to be kept very much within the public health complex. There's really no need to share it beyond that as far as the health information. And, as far as the time that it's retained, there are specific regulations on how long we have to retain this data. I can't recite those chapter and verse. But we follow the policies there and destroy the data after the required time period and those kinds of things. So I think I get the privacy thing, and it is a big issue for a lot of people, and we're doing everything we can to maintain folks' privacy.
Great. And this question actually might go to Lieutenant Governor, is if someone comes in contact and you've been contacted by a contact tracer and they say, you may have been exposed, we would like for you to take the next 2 weeks off of work, and maybe they've just gone back to work or they haven't been off work. With this person, and some people obviously would have paid sick leave, but in the cases that some people may not, or if they're part-time or something like that, with these people, if you've been in contact with someone that had tested positive, could you be eligible for unemployment for those 2 weeks? Or would there be any kind of relief if you feel fine, you're healthy, but yet you've been in contact and want to do the responsible thing and stay home for a couple weeks?
So that's a great question, and we are looking into that. As many of you know, the executive order that the governor implemented what seems like a lifetime ago now, but at the beginning of March, which expanded the unemployment insurance coverage to people who've never been eligible before, is one of the reasons that we've been able to take on so many folks, and to make sure that obviously we protected our families through this. So one of the things that we're looking at is the responsible thing to do, like Ashley just said, is to obviously follow those directives. Now, many of the folks who have had unemployment insurance extended to them, it's very COVID specific. And so we're looking at a COVID specific executive order potentially as we move forward to see how that will fit into the system as well. And so it's something that we're looking into right now. And it's certainly something that we're aware of, that if you do the responsible thing, we want to make sure that just like during this time period, we don't let our folks fall behind. So there will be more coming on that.
Great, great, thank you. One question we've gotten several of, which is a positive thing. We know unemployment is high here in Kentucky. We want people to get back to work as quickly and safely as possible, is you guys are going to be hiring 700 contact tracers. So how can people apply for these positions?
Well, we will be in essentially, Ashley, tomorrow, probably by the close of business tomorrow. And I'm going to caveat that a little bit that it could be delayed a day or so. But there will be a link that'll go up on the covid19.ky.gov website that will link to a number of staffing agencies that we contracted with to basically identify and hire these folks. And so each one of those agencies will have something of a geographic focus. So, you know, there was no single agency that covered the whole state. So if we've got folks in the Purchase all the way over to Pikeville. But there'll be a web link that goes up probably by the close of business tomorrow. And that's how folks can get connected and get started. I will say that because the awards were made last Friday, a number of the agencies had already posted positions and started receiving applications even ahead of us getting through our process that you have to follow in state government to get things stood up. So it's actually quite quick to get it up in a week in this environment, much like the IT implementation. I think it's phenomenal how fast that went.
Absolutely. One more question probably before we leave. I want to be closing on time here, is what about healthcare workers? We do have a question about that. So if you are a healthcare worker and you're in a hospital, or you work at the first care that are doing the testings or whatever it may be, you may be exposed to quite a bit. And they're obviously taking the precautions by wearing the necessary PPE. But how will contact tracing affect our healthcare providers who are really on the front line?
Well, it'll be handled similarly to the way just any normal citizen. I would say that most of the healthcare providers have their own testing and isolation policies that they've put into place. But there's still the requirement that it's reported to the health department. And, probably it just depends on the provider. A large sophisticated system like Norton Healthcare, there's probably a fair amount of that we could collaborate with them to do, as opposed to having the state do it. But some of our rural hospitals that might not have the capabilities or really just the staff to do that, that's probably going to be more of a health department driven approach.
Great. And so lastly, I think just to reiterate, while we have all these business leaders on the call today, if you are doing your screenings and you are talking to your employees and making sure that they are healthy when they come in the facility, if one does show up with a fever or the symptoms, absolutely have them get tested. And then from that point on, if they are positive, the health department from here on out really will take kind of that and do the contact tracing. Is that the basic steps, Mark, that we kind of need to relay to all businesses today?
You said it well, Ashley.
Great. Well, thank you all. Thank you all again for explaining all of this. It is a new system, a new process that we're getting familiar with. So we had lots of questions, but I do think we have gotten a lot answered. And like I said, this is something that I think we're all trying to work toward is, if this does spike again, how can we keep people healthy but keep the economy going? And I think there's a lot of optimism right now from the business community here in Kentucky now that things are starting to reopen. And before we leave, I'll just leave you guys with a little poll that we did recently. We polled all Kentuckians, a statewide poll a couple weeks ago, saying that when the government says it's time, it's safe to go back out and businesses are reopening here in Kentucky, do you feel safe doing so? And even I was surprised that it was about 81% of respondents said, yes, we are ready to kind of get back out there, get back to work, go back to that kind of our new normal lives. And I give a lot of credit to what all Kentuckians have done the last 2 months to be responsible and keeping people safe. And just like businesses across Kentucky have closed down and done what they needed to do to keep everyone safe the last 2 months, just know they're going to do that as we move forward. So it's been really remarkable to see the extent that businesses have gone to, even in the last couple of weeks, of getting ready to reopen in a really safe way. So consumers, employees all feel safe coming back to work. I think employers, we know that onerous is on us to make sure that employees and the public feel safe coming back to our establishments. And so they have been nothing but responsible the last 2 months. And I know we're going to be that way moving forward. So however we can help you all in your endeavor, just know that we will help make sure that we keep everyone safe as we move toward our reopening. So for everyone listening, thank you guys for taking time today to get educated on this process. We will, just like all of our other webinars, put this on our website, kychamber.com. So feel free to share this after the fact if you know someone that maybe would have liked to listen in and did not have the time to do so. And as always, reach out to us at the Chamber if you have any questions. Mark, Lieutenant Governor, thank you guys so much for participating. And we look forward to talking to you and hopefully seeing you guys again soon.
Thank you, Ashley.
Thank you all. Have a great afternoon.
Bye.